Hi, I'm Molly. I'm one of Dr. Biesman's nurses, and I'm here today to talk with you a little bit about some of the changes that happen in the face as we age and volume starts to shift and move, and some things that we can do in order to improve your overall appearance but keep you looking like you. So as we age, we have changes that occur in the face through your cheeks here, in your temples, underneath the eyes, down here through the outside part of your cheeks and along your jawline and around the mouth. There's a variety of different fillers that are available on the market that we can use in order to make some changes there. There's a spectrum of hyaluronic acid-based fillers like your Juvederm, Restylane, Belotero, Perlane, things that we can use in different faces to achieve different type results. There's also a product called Sculptra that we use primarily in this part of the face here between your cheekbone and your jawline to help just to soften that transition some. We also use that product in the temples to soften the contour from the forehead bone to the cheekbone. Let's talk about hyaluronic acid-based fillers first. So the hyaluronic acid-based fillers are designed to reestablish volume underneath the eyes, where we particularly use a product called Restylane. It's less likely to pull water, causes less puffiness. There's a few products, including a new one that we use in the cheek portion of the face. We use Juvederm Ultra and Ultra Plus to give us some fill and some plumpness to the skin. But then there's a new product called Voluma that we use that's designed is to actually create some lift. So we're looking to actually pick things up, and we can use that in the cheeks here to almost like tent poles to kind of pick tissue up that has started to come down. We can use it along the jawline to contour some, and we can also use it in the temples. That product is a little bit stiffer and can actually last a little bit longer as a result of the way that the product is actually formulated. There's some other products that we like to use around the mouth. You can use Restylane, you can use Juvederm, depending on the type of skin that you have, how thick your skin is, and what type of an overall result that we're looking for. We've also developed kind of some new techniques with a product that's been on the market for a while, a product called Belotero. Belotero is also a hyaluronic acid-based filler. It's a really soft product that allows us to be able to fill in some of those fine lines that still exist after you've reestablished volume in a given area. So for the area around the mouth, when the lips have deflated some, you've lost some volume around the mouth, we can reestablish that volume with one product. And then if there's still those fine etched in lines that bother people, or even the fine etched in lines that happen when we smile and then when even the face is relaxed, we can use this product superficially to help to soften some of those individual lines, which is a nice feature to be able to have. All the hyaluronic acid-based products are products that we can change, we can manipulate, and ultimately we can dissolve them and take them away if we need to, which is always nice to be able to kind of have an out if you need one. Those products typically last about 6 to 12 months. We like to inject people to just about to full correction, to where you're happy with the way that things look, we're happy with the way that things look, and then check you back in about 4 to 6 months, because we don't want to allow all the product that we've injected to go away and then kind of starting again from ground zero. Products like Sculptra that we use through this part of the face here to reestablish volume, and in the temples. Sculptra is a product that works a little bit differently than your hyaluronic acid-based fillers. That's a product that is actually made from a material, it's a synthetic material that is found in surgical suture that we've been using for decades. What that product does is it stimulates some collagen production by causing a little bit of inflammation in the tissue. So that inflammation triggers a response in the body to activate the cells that want to go to work and build up collagen. So when that happens, it's not something that happens right away. So unlike your Juvederm and Restylane hyaluronic acid-based products, you get your volume replacement right away. This is a product that you have to wait. It has to actually go to work, and your body has to actually build something. So it takes some time. Anywhere from about 4 to 6 weeks after your initial treatment is when we start to see the effects of the product. It's almost like planting grass seed. We plant the seeds and we kind of wait for it to grow. It's not uncommon to have to do more than one treatment, depending on how much collagen your body actually gives us. So we like to kind of wait that out and see. Things to expect after your injections. It's not uncommon to have some bruising, to have some swelling that can last anywhere from just a couple of days to up to 2 weeks. So if you have an event that you're trying to get ready for, planning that accordingly is helpful. We have used cold compresses afterwards. There's a homeopathic supplement called Arnica. Comes in a gel and in an oral form that's helpful, that we can apply to the skin after your injections and that you can take home with you afterwards. We also have a laser that we can use anywhere from 24 hours after your injections. If you do get a bruise that you can't cover up, we're happy to treat you at no charge for that. We do like to follow up in 2 weeks just to check and see how everything looks and how everything has kind of settled in, and then evaluate there for additional treatment. It's also helpful to avoid taking aspirins, ibuprofens, fish oils, flaxseed oils, anything that's designed to thin the blood if you can, prior to your injections, because it just puts you at a low risk for getting a bruise. I hope you found this video helpful. If you have additional questions, either myself or Dr. Biesman would be happy to assist you.